Welcome to the HealthSense Revolution Software Overview and Value Proposition presentation. In this segment, what we're going to do is to introduce you to our revolutionary new software tool, Revolution Software, as well as talk about how negotiating your payer allowables for maximum reimbursement can optimize the revenues and profitability of your practice. Let me begin by talking about what's in it for your practice or ASC to utilize HealthSense products and consulting capabilities. First and foremost, this is about wealth building wealth for your practice, for your ASC, and doing so by acquiring a set of products and services that can enable you to maximize your payer agreements. First and foremost, what drives revenue into a practice or ASC is in fact the in-network reimbursement that occurs on your commercial agreements in addition to your Medicare agreements. So by getting an understanding of how your commercial agreements benchmark relative to Medicare, and for that matter relative to other practices and ASCs in your Medicare locality, in your state, and in the USA, will help you to, in fact, maximize your reimbursement because you'll understand what to ask for and how it compares to what others are already receiving. Second, we provide an out-of-network analyzer capability, and this is within our Revolution software tool, a business model that allows you to determine financially rather than just emotionally whether or not you're actually better off being in-network or out of the payer's network and moving to a cash-based business. We look at factors such as what percent of your patient base might you lose in the process of moving to an out-of-network agreement, how much incremental cost might there be to administer, and how does this play off of factors such as what if I got a 10% increase, and you'll be able to, on the fly, change any of the variables in this particular model to help you better calibrate this decision. And third, we provide a contracts analysis tool to help guide you through the operational language and business constructs in a typical payer agreement that can affect the flexibility and reimbursement terms of your actual payer agreement. These are constructs such as term and termination, how quickly claims get paid, the amount of liability insurance that you're asked to carry, the lesser of language comparing your payer allowables to bill charges. Those sorts of items can in fact have a very high degree of effect on your contract and on your ability to maintain profitable terms. So fundamentally, what's in it for the practice or ASC, what's in it is building wealth and building revenue and profitability. We have many client references. We have Mr. Doug York, who is the CEO of Hudson Valley Urology. We worked on about a dozen agreements for Hudson Valley Urology, and these were all commercial PTO agreements in the New York area, and we were able to derive another $800,000 of incremental revenue coming into this practice after this engagement, and that was using a combination of our Revolution software tool to analyze these agreements, as well as our consulting capability to actually renegotiate the agreements with the data and information provided by the Revolution software tool. We have many other references. We posted a few here. Mike Sinowick from Peninsula Urology is another with similar returns, and Dr. Harry Neuwirth, who's the urologist here in Marin County, believed so strongly in the results he achieved that he decided to join our board of directors and participate in the Revolution software venture, which we now have formed under the HealthSense Revolution Corporation. Our current leadership, that's me down at the bottom, not at the top. I'm Steve Selfst. I'm the CEO of HealthSense and HealthSense Revolution, and I have been involved in contract negotiations for about 5 years and bring a 23-plus year background in software development in actually a large Fortune 10 company. And have a high degree of experience both in negotiating contracts as well as in software development, and I've done over 1,000 payer agreements in the last 5 years since I joined HealthSense and I've run our operation. Susan Charkin is my colleague and co-owner of our businesses, and she is founded HealthSense back in 1994. She has a very rich and deep background in the healthcare industry. She led contracting for several large payers, including HealthNet, Blue Cross Blue Shield in 2 different states, Aetna. She was the director of outpatient surgery for the University of California at San Francisco, directed contracting for MaxiCare, and also most recently was a trustee in one of the largest hospitals in the Monterey Peninsula, the Natividad Hospital. She's a well-renowned individual in this space. She's a leading author, national speaker on the topic of contracting, and she also has her MPH degree. So between us, we bring the collective skills of general and executive management, contract negotiations, business development, and a rich healthcare background in leading the team of professionals that we have that comprise the HealthSense and HealthSense Revolution organization. Now let's talk about the value proposition specifically of the Revolution software tool and why this is an important tool for you to consider in the operation of your practice. Now first off, I want to mention that this is a web-based service, and this is the only web-based service on the market today that deals with contracted allowables and payer agreements. The issue confronting ASCs and providers alike is that first and foremost, they have to worry about the operation, the flow of ebb and flow of patients in and out of the practice, the scheduling, making sure that claims get paid on time, that claims get filed, that they get tracked, that everything can be done that's possible to enhance cash flow into the practice. And this is typically done with a billing system along with billing personnel that focus on that aspect of the business. In addition, there's often operational reporting that goes along with this type of a billing and collection system where accounts receivable are tracked, case rates are analyzed, even surgical profits by physician and case are looked at, patient clinical trends. All of these types of things are once again focused on the operations of the practice and making it effective. However, what's missing here is, and where we come into play, is the contract negotiations and understanding contracts and what can be done to maximize the payer allowables on agreements so that at the end of the day the practice can increase its profits by obtaining new and more profitable agreements. And in fact, when you think about it, you could be running a great operational system and doing a great job billing and collecting, but if you're leaving 20 to 50% of your payer allowables on the table because you're being under reimbursed, that means that your practice is leaving 20 to 50% of the revenue on the table that it could be making that it currently is directing into the hands of the payers. And that's what Revolution Software is about. That's what our consulting capability is about, is to really dissect scientifically the reimbursement, the fee schedules, calibrate them, benchmark them, determine where you stand, which ones you can realistically negotiate for more profit, and which ones aren't worth negotiating because they're already favorable. We also look at your charge master, and we find that many times charge masters are not audited and they're set too low, and even for the small percentage of your practice or ASC revenue that may be cash-based, money may be left on the table. So we're all about complete revenue cycle management, covering all aspects that control revenue flow into the practice or ASC. The Revolution software tool, which you can look at on this web page as well, is focused on enabling the practice and ASC to be able to import contracts and payer fee schedules and charge masters into a single place in a secure intranet environment. And what this particular web service will do is it will quickly analyze your payer allowables, determine how they benchmark not only relative to Medicare, but relative to reimbursement that others are receiving for similar code mixes in your region, or Medicare locality in the state and in the and across the United States. We also will tell you who the other practices are of your type that are within your county, within a proximity outbound up to 20 miles away from where you are. This is a very critical element in the licensure, affecting the way insurance companies look at the mix of providers that they need by specialty, so that's another factor you'll want to be aware of. We do the contracts analysis in this tool, which is a question and answer process, whereby you'll determine whether or not you have enough flexibility in your contracts, and business modeling, which is basically the out-of-network analyzer, as well as the charge master analyzer. And we have a one-stop shopping, complete storage mechanism on the intranet for you to store and manage all of your contracts and fee schedules, etc. This is all through what we call a SaaS, or software as a service. It means it's all on the intranet. It's through the internet, through a secure intranet SSL-based system that protects the information that's so critical to your practice, while at the same time providing you access from anywhere at any time. And we do a great balance here of making it easy for you to use, yet powerful enough to provide value. And that's really been the focus of this new software web service that we have. What you get out the back end is very important information. I stress information and not just data. You can analyze contracts. You end up with more profitable contracts because now you understand the contracts, which codes to ask for more reimbursement on, and how to go about negotiating these agreements with the payers. You can end up with more revenue by adjusting your charge master to UCR levels, and you get better data to negotiate with, which is very critical when you're dealing with a payer. You need to be on a level playing field and have the data and information that you need to be able to discuss an agreement with a payer in a way that is going to connect and enable the payer to consider an increase. And at the end of the day, you get other options. Going out of network is one of them. That's the end of this segment. I invite you to look at our Revolution software demonstration in the next segment.